welcome back and welcome to the Preemie Power Week. If this is the first session of your day, I am Fabiana Bacchini, Executive Director of the Canadian Premature Babies Foundation, CPBF, and your host for this event. The Preemie Power Week is the second of two international live series that CPBF is hosting 2020 in recognition of World Prematurity Day. These educational sessions are in collaboration with the International Family Integrated Care Committee, the Canadian Association of Neonatal Nurses, EFCNI, and GLANS, the Global Alliance for the Newborn Care. For those not familiar with CPBF, we are a charitable organization, and our mission is to support and educate Canadian families of premature babies every step of the way. We believe that through consistent information, access to helpful resources, and peer support inside and outside an ICU, we can empower families, ensuring they are ready to care for their baby. Consistent information is especially important today when we are facing a global pandemic. With educational sessions like this, we intend to bring you the guidance of healthcare professionals and the knowledge gathered by researchers around the world. These are valuable tools to help our community raise awareness and advocate for the well-being of families and their babies. I would like to thank AbbVie for the unrestricted educational grant and Pampers for supporting the Preemie Power Week. And right now, we're going to talk about caring for your preemie baby at home. Dr. Liu will provide tips on caring for your preemie baby at home. She'll discuss topics from how to care for your preemie skin to baby sleep tips. Dr. Stephanie Liu is a family physician and assistant clinical professor at the University of Alberta. She graduated from Columbia University with a Master's of Science and completed her Doctor of Medicine at the University of Alberta. Dr. Liu is the creator of parenting blog Life of Dr. Mom, where she discusses her experiences as a first-time mom and provides evidence-based child and maternal health information. Her goal is to provide parents with a credible medical resource so they can make informed decisions when it comes to the health of their families. Dr. Liu, thank you so much for joining us here today from Edmonton, Alberta. What an honor to have you in our life.
Oh, thank you so much for having me. I'm so happy and honored to be here today.
And for all of those watching us here, please send your comments and questions on the box below, and we'll address them at the end of Dr. Liu's presentation. Dr. Liu, feel free to share your screen and walk us through your presentation.
Perfect. And so, sorry, Fabiana, I'm still getting used to the text.
No
is this good right now, Fabiana?
It's perfect now.
Okay, great. So once again, I'm so honored to be here today to talk about caring for your preterm baby at home. We're going to talk skincare, we're going to talk sleep, and we're going to talk skincare. So this is an overview of the talk that I'll be giving. First, I'm going to talk about some of the challenges I experience as being a new parent. I'm going to talk about preterm skin health. What are some of the differences between full-term versus preterm skin? I'm going to then talk about some of the common skincare concerns. Kangaroo care, what is it? Why do we do it? Then I'll be talking about sleep. Why is sleep important? And some of my newborn and preterm sleep tips. Then I'll be discussing sleep safety. And finally, we'll end off on self-care, why I think it's important. So these are two pictures of my kids. Maddie, she's now 4 years old. And this was the day that we were taking her home from the hospital. And you can see here, she's in a jacket that is incorrectly put on because me and my husband were so nervous that day taking her home. She felt so fragile and so little, and we were nervous and we couldn't even put her into her jacket properly. The next picture is a picture of my son, George. He's actually a year old already. And you can see there, we're a little more comfortable with parenting. He's in a appropriately sized outfit, and we remembered to bring a tube to keep his head warm on our drive home from the hospital. So I mentioned this a little bit earlier, but I think being a new parent is hard. There were a lot of unexpected challenges that came up. I love being a parent. I feel so lucky to be a parent, but it's also a lot harder than I anticipated. The first picture I have of me there is a picture of me really, really tired. And that's because being a parent to a newborn is exhausting. It was more tiring than anything in my medical training. I was up overnight many nights during my residency training, but residency training compared to new parenthood with a newborn, I would say new parenthood with a newborn is way more exhausting. The next picture is a picture of my daughter Madi and me. And I remember before having my daughter, one of the things I looked forward to the most was breastfeeding. I was so excited to experience that bonding that people talk about, that connection that you feel when you're breastfeeding, and of course all of the other health benefits associated with breastfeeding. And then I tried to breastfeed Madi, and it was really freaking hard. It was not intuitive, and it was really challenging. And it made me feel really bad about myself when I wasn't able to breastfeed. My experience with breastfeeding has actually changed me, I think, as a physician, because now whenever a patient comes in talking about their challenges with breastfeeding, the most important thing to me is to make sure that they feel supported and that they know that regardless of whether or not they're able to breastfeed, that they are doing an amazing job. The next picture is a picture of me and my husband. This was way pre-kids, when we were both still residents, and we were hiking in Cinque Terre then in Italy. And we were both so happy when our kids came into our life, and we felt so blessed. But at the same time, our relationship dynamic changed. Before our kids, it was just me and him. We were the only two people that we needed to worry about on a daily basis. And then we had these amazing little kitties that joined our lives. But with the addition of new people, it definitely adds more complexity and changes to relationships. The last picture is a picture of my son, George, when he was, I would say, I think about a week old. And, even looking at this picture, I just feel overwhelming love. I felt overwhelming love with both of my kids. But at the same time, I also felt overwhelming worry, more worries than I've experienced ever before having kids. I worry about, am I cutting their nails properly? What's with the boogers in their nose? Is their poo normal? And I'm a healthcare professional, and I question myself daily too. As an additional comment, it was hard for me, and parenting is hard in general. And I didn't even have a preterm infant with a prolonged stay, and I didn't have a baby during a pandemic. So for all of you listening, I think you guys are all amazing. So newborn skin. Skin, as some of you guys may know, is actually the largest organ in our body. There's many functions to the skin. It's important for protecting us from UV light. It helps protect us from microbes. So it acts as a barrier to bacteria in the environment. It helps us regulate our temperature. It allows us to feel sensations. Through our skin, we can feel heat, cold, touch. Newborn skin is not as developed as adult skin. It's actually more susceptible to injury, to minor abrasions, to infection, and to heat loss. It's important to note that skin is not mature at birth, and it continues to mature until the first year of life. Preterm skin is even less developed than term newborn skin. And they're at a higher risk of infection. Preterm infant skin is at a higher risk of infection, skin breakdown, and temperature regulation problems. It's important to note that, fortunately, by 2 to 3 weeks after birth, preterm newborn skin is comparable to full-term newborn skin. So this is a picture of Madi. She had a short stay at the NICU for some respiratory problems. And I'm sharing this picture because with this picture, I'm able to highlight some of the potential areas for skin damage. So she has some stickies on her chest and on her tummy, and those are to monitor heart rate and breathing. It's important to note that when these are taken off, it can cause skin damage. The other thing that you might notice on Madi's right leg is a blood pressure cuff. It's important to monitor blood pressure, but this is also a potential site of injury to the skin. And then there's also a random picture of a bathtub there. And the reason the bathtub is there is that bathing can actually cause irritation to the skin too. So some general skin protection tips I have for the preterm babe is being aware that damage to the skin can occur from pressure injuries such as blood pressure cuffs. So making sure that we're monitoring the skin regularly and changing position as frequently as you can, and also changing positions of things like blood pressure cuffs, switching up the legs. Stripping from medical adhesive. So one thing that's recommended is using the smallest amount of tape possible. Another tip is petroleum jelly, also known as Vaseline. It acts as a great skin barrier. So just lather that on, and that will also help act as a barrier for those adhesive devices. The other thing to note is there's now more products on there for more products available for preterm infants. So for example, there are some diapers in the market that are specifically made for preterm infants, and they have these gentle peel adhesives to make sure that the skin doesn't get damaged. As I mentioned earlier, bathing can be irritating for the skin. So make sure first to check in with your healthcare provider to make sure that it's safe to bathe your preterm babe, because early preterms may have not fully developed their temperature regulation. And we only want to bathe preterm babes once their thermal regulation is more developed. Another thing I learned was you don't need to give babies baths every day. It can actually dry out the skin. Avoid scented products. Scented products can cause irritation to the skin. And if you do decide to use a little bit of shampoo or soap, use it sparingly and make sure you do it at the very end so that the baby isn't soaking in the soapy water. Okay, diaper rashes, super common. They affect up to 24 to 40% of NICU neonates. Both of my kids actually had diaper rashes during the first month of life. So I use the acronym ABCD to help me remember some steps for managing diaper rash. So A is air. One thing that I recommend is having some, if possible, having some diaper free time, but making sure you're prepared. So what I would do would be I'd put a towel down and make sure that I had a towel handy. And when I take off the diaper, make sure that the towel's there and the diaper's there. My son in particular loved peeing the first month of his life whenever he was exposed to air. He would pee and he peed in his own face, and he's actually peed in my face too. So what I want to make sure, what I did after that experience was I made sure that we had the towel there and that I had a diaper right away to put on if he were to start peeing. So air is great to let that skin in the diaper region kind of breathe. The next thing is barriers. So barriers are great ways to protect the skin. So one product I mentioned already was petroleum jelly, also known as Vaseline. I would liberally just put it on the baby's diaper area. And this helps protect when poo and pee is about to encounter the skin, because it acts as a little barrier from the skin to the poo and the pee. Or you could use zinc oxide. And zinc oxide is that white diaper cream. The other thing is that's important to note is cleansing the area. So poo in particular is really bad if it's left on the skin for a long time, because it can cause a lot of irritation to the skin. So what I would do would be I'd either wipe off the area with some fragrance-free wipes, or even just kind of run the bum under some lukewarm water just to clean off all the poop. The next thing is diapers. I recommend super absorbable diapers that are unscented, just to help minimize the moisture in the bum area. And this is actually a picture of my daughter helping me change George's diaper when he was first born. So here's some general skincare tips that I have. Preterm and term newborn skin is still developing, which makes them more susceptible to irritation and infection compared to adults. Moisturize, moisturize, moisturize. It's really important to lock in moisture for newborn skin in general, and especially for preterm babes. So petroleum jelly, I would liberally just kind of put that all over the bod, or you could use an unscented hypoallergenic cream and liberally apply that to the baby. Bathing. As I mentioned, I recommend checking in first with your healthcare provider to make sure that it's safe to start bathing your babe. And the next thing, which I kind of mentioned, was note that you don't need to bathe daily. Another great tip that I learned is don't rub the skin afterwards to dry it. Gently tap dry the skin and make sure that you leave a little bit of moisture on the skin so that the skin still feels damp. And while the skin still feels damp, take Vaseline or a hypoallergenic cream and layer it on there. And it really helps lock in the moisture. Another thing to note is some people, adults and children and newborns, can get reactions to certain types of laundry detergents. So I recommend using a gentle laundry detergent if you've had a reaction, or you could even just start your newborn with clothes that have been washed in a gentle laundry detergent. Kangaroo care. So what is it? So this picture, I think, explains kangaroo care pretty well. It's a picture of me and my son, George. And what we're doing is we're skin to skin. So he's wearing just a diaper and he's on my bare chest. And essentially that's what kangaroo care is. It's that skin to skin contact between the caregiver and the babe. So there have been multiple studies that show that skin to skin care is really beneficial for preterm babies. It helps with temperature regulation. It also can help improve sleep, particularly in organization and in duration. It can help prolong sleep too. It's also important that studies have shown that it can help improve cognitive function. So it helps with brain development. It has also been shown that when moms do more skin to skin time, it can help breast milk production too. And one of the most remarkable things that I saw when I was doing my NICU rotation was that, and this was when I was back in residency, but I still remember this, is that I've seen a baby with a really high respiratory rate, so they're breathing really quickly, and right away when they're put on their parent's chest, you could see the baby trying to breathe at a rate similar to their parents. And studies have shown that skin to skin time helps with breathing stability. There are procedures that are done in the NICU that are painful, and skin to skin contact has been shown to actually help with improved pain responses. Another study actually showed that skin to skin can enhance attachment behaviors, and I felt this firsthand. When I had my kids skin to skin with me when they were newborns, I felt such closeness. And really, studies have confirmed that it really does improve attachment with parents and with caregivers and the babe. So preterm sleep patterns. So sleep is essential, as many of us know, to physical and mental development, and particularly for babies. Term newborns sleep a lot. They sleep 70% of each 24-hour period. And preterm babes sleep even more. They sleep about 90% of the time. As preterm newborns develop, their sleep patterns will generally resemble the patterns of term babies. However, some preterm infants may actually have more variable sleep that's not as consistent. And this typically can last in the first year of life compared to term infants. Here's some of my sleep tips. Although preterm and term infants don't have a developed circadian rhythm yet, I think it's important to encourage good sleep habits early on. So circadian rhythm is our body's ability to know what's daytime and what's nighttime. For preterm babes and newborns in general, this doesn't develop until they're at least 4 to 6 months of age. However, I still think it's good to have encourage good sleep habits early on. So the first thing I recommend are semi-structured naps during the day. So what that means is kind of checking in on your watch. I don't have my watch on right now, but timing around every 90 minutes and saying, you know what, around every 90 minutes, I'm going to try to put the babe down for a nap. This is important, I think, timing, especially for preterm infants, as sometimes they're not able to show clear distress signals that they're tired. So they may not be rubbing their eyes or yawning. So that's when I think timing is helpful to prevent the babe from getting overstimulated or overtired. I also think it's beneficial to keep nighttime feeds and diaper changes in a minimal stimulation, darkened room. And this is helpful because I think that over time, the baby will start to recognize, you know what, this is nighttime, this is a time for sleep, and this is a low stimulation time right now. Another thing that I think is helpful is having an environment that's conducive to sleep. So one, setting the temperature of the room. It's recommended that babies sleep somewhere between 18.3 degrees Celsius to 21.1 degrees Celsius. So setting the temperature of the room somewhere in between there. We like a hotter room to sleep in, so we make it a little bit closer to that 21. Another thing that I recommend is a bassinet in the room with you, and making sure that that mattress is firm and that's flat and that there's no pillows or blankies in there. And this kind of leads into my next tip, safe sleep tips. So you see a baby there, and and his crib looks really, really boring. He does not have any stuffies. He or she does not have any stuffies. They don't have any of those crib bumper rails. They don't have any pillows or big blankies. And that's because the safest way to sleep is essentially in a really boring environment. So what we recommend is a firm, flat mattress, no pillows, no comforters, no blankies, and that the baby sleep on their back. It's also recommended to avoid smoking. And the reason that we recommend all of these tips is there's something called SIDS, sudden infant death syndrome. And they found that back to sleep, firm, flat mattress, nothing in the crib is actually one of the safest ways for the baby to sleep. And this reduces the risk of SIDS. The last thing I want to talk to you guys about is self-care. I mentioned this at the start of my talk. I think being a new parent is hard, and I think that there's a lot of unexpected challenges. And I think that as a parent, we need to know that we're doing a great job, and to be kind to ourselves and to give ourselves a pat on the back and say, you know what, I'm doing good. I'm doing great. The next thing is, and it's more challenging during COVID for sure, is to not be afraid to ask for help. I was fortunate when I had both of my kids. I had my parents and my in-laws being able to stop by frequently to help look after the kids so I could, you know, shower, cook a meal. And unfortunately with COVID, we aren't able to have visitors to homes anymore. But there are other things that people can do for you if they want to help. Is, you know, if someone says, hey, can I drop off a nice meal for you? Can I drop off dinner? I would say go for it. I really struggled being able to accept help with my first babe. And with my second, George, I had no issues. If someone said, drop off a meal, can I drop off a meal? I'd say, sure, absolutely. I'd love it. The next thing is take breaks. It's busy being a parent. There's so much to do between diaper changes, breastfeeding, feeding with a bottle. And if possible, and you live with someone or you have a partner, be able to take breaks for each other. So, you know, say, oh, would you mind watching the baby while I quickly take an uninterrupted shower or drink a coffee for 15 minutes quietly by myself? Yes, I highly encourage breaks. The next thing that is safe to do during COVID is to go for walks outside. We love going for family walks, and we still do now, especially during COVID. Even just going outside for 15 minutes when I had both the kids when they were newborns was so recharging for me. Finally, if you are struggling and you are worried about your mental health, please see your healthcare provider. We are here for you and we care. Finally, if you want to get a hold of me of any additional questions, you can reach out on my email, lifeofdrmom@gmail.com, or social media. I have an Instagram account at lifeofdrmom, or on Facebook. If you want more tips, you can check out lifeofdrmom.com. That's my website. It's been an absolute honor to talk to you guys, and I will open it up to questions. I'm just gonna...
Dr. Liu, thank you so much for sharing your story so authentically with us and for sharing your medical knowledge. If you don't follow Dr. Liu's social media, please follow her now on her Instagram account or Facebook or website. She has great tips for all parents, but for us parents of premature babies, there's some tips that are so important for us because you don't think that some things that happen to babies at home are part of growing up as a baby. We always think that could be a medical condition. So very important information there for all of us. So Dr. Liu, going home with your preemie baby, it's a dream that all parents have while in the ICU. You dream about that day. We count down to that day. But it can also be very intimidating because we no longer have the ICU staff around us to provide support and to take care of the baby. And sometimes, most of the time, to bring the baby home without the monitors and the alarms. It is not an easy transition. So share with us your transition, because you mentioned you spent a few days in the ICU with Madi. So how was that experience for you, and how did you prepare for that?
Yeah, so everything that you said, we were so excited on the day, you know, leading up to it, we were so excited, so we cannot, oh, is that okay? There's a bit of background noise. Is that okay, Fabiana?
Okay.
Okay. So oops, sorry, think it's my computer issue. We were so excited when we were bringing Madi home. Like the day leading up, we were just thrilled about it. And then
we can hear you.
You can hear me? Okay, good. It sounds kind of rattly on my side, but it's funny because my husband and I, when we were actually taking her home, we were so nervous and because we couldn't imagine doing it without our amazing nurses and the team at the NICU. So essentially what we did leading up to it was a few hours before discharge, I stayed with Madi and my husband went to set up the room and make sure everything was ready. So we made sure that we had diapers ready, that we had a few changes of clothes, that our laundry was done prior to her coming home. And that we had the bassinet ready to go in the room and that we had bottles, everything ready. But I don't know if there's anything that can 100% prepare you because it is different when we transition back. We were really questioning ourselves the first few weeks and did a lot of reassurance ourselves. But yeah, I would say get all the physical stuff set up. And then that's probably the best tip that I have.
Absolutely. So now parents preparing to go home from the ICU during the pandemic, do you have any recommendation? How can parents prepare going home during this time that is incredibly challenging for families? There is more isolation and not everything is open in the community. A lot of appointments are done online. How can we possibly prepare the parents and give some recommendations on that?
Yeah, so this is an unprecedented time. Like one of the things that one family asked me, they just had their first child. It was actually the first grandchild of the entire family. And they said, it's very important that, we're able to keep in touch with our family members because it's such an exciting time. And I would say the one thing that has really helped families, and I encourage them to do this regularly, is FaceTime. Like we're very lucky that we have video chatting available. It's not the same, but it's definitely something that I think allows people to still stay connected. So I recommend lots of video chats with families to stay connected. And I would say also, I recommend, as I mentioned in the talk, going outside for walks and things like that, just to stay active too.
Absolutely. Dr. Liu, your biggest challenge as a new parent? Share with us.
Yeah. So I kind of mentioned some of them already, but I think the biggest challenge for me was breastfeeding. I had such high expectations of being able to really connect with my daughter and be able to breastfeed her right away. And when I struggled, it made me feel really, really bad about myself. And I think that, as I mentioned, that's made me really want to make sure that I can support mothers as much as I can, that if they are struggling to breastfeed, to connect them with people such as lactation consultants to help them breastfeed. But if they really cannot and they have issues with milk supply, to know that they're still doing an amazing job and that does not reflect them as a parent if they're not able to breastfeed.
Absolutely. And how important it is for families to continue to their follow-up appointments and reach out for help of the healthcare professionals, because in the beginning of the pandemic, a lot of families were actually afraid of leaving the house to go to a hospital or a doctor's office because they were afraid of contracting the virus at those facilities. So we still encourage parents to go. Places are safe and protocols in place. They have to continue going for their vaccinations, for RSV shots during this time.
I completely agree. At the start of the pandemic, people were not seeking medical attention. I even had a patient, and this is not a child, but an adult that had severe abdominal pain. And she didn't want to come in to see me for fear of contracting COVID. And she actually had a ruptured appendix, which is something that's life-threatening. Unfortunately, she did come to see me and sent her quickly to get to emergency, and she was operated on within the next 3 hours. And similarly, if you have concerns, and you're afraid to go see your physician right away, or your healthcare provider, just call into the office. A lot of clinics are offering a phone consultation too. And at that point, they can direct you whether or not you would need to come in. But please, please, please do reach out to your care provider if you have concerns.
Absolutely, especially with a premature baby.
Yes.
Let's talk a little bit about the book that we just launched. I was very happy to hear there is a book out there to teach kids about COVID-19 and why do we need to keep social distancing and wear masks. Talk about how did you come up with the idea of George Shark and COVID-19, and what is the book all about?
Yes, I wrote a book for my son. His name is George, but his nickname is Georgie. And actually, do you have the book there?
I don't have it on my desk right now.
I'll later, but there's a picture of the Georgie shark, and he's kind of got my son's crazy hair, and it's kind of spiky. And when I think of my son, I think of him being a shark. And I was explaining to my daughter, what COVID is, and I was talking about my son, using him as an example. And essentially what that book explains is why it's so important to hand wash, or I call it fin washing in the book, why it's important to maintain social distance, and why masking can help prevent the spread. But at the end of the book, I talk about, and I truly believe this, that if we work together with time, we will get through this. So it's a book of, talking about the safety, but also a book that I hope provides hope that things will get better if we all work together.
Absolutely. Dr. Liu, thank you so much for joining us here today. It was a pleasure talking to you, and I will keep following on social media to learn much more about how to care for preemie babies at home. So thank you so much for today.
Oh, it was my pleasure. Thank you so much for having me.
Thank you. And thank you all of you for joining the conversation today. It is World Prematurity Day, and tonight 28 monuments in Canada will be lit up in purple to honor the preemie babies and their families, and also remember the babies who left us too soon. And in honor of Prematurity Awareness Month, in collaboration with CPBF, Pampers will donate 200,000 diapers to support Canadian families and NICUs during November and December. Until the end of December, every time you hashtag Pampers for Preemies, Pampers will donate one extra diaper to Canadian ICUs through the CPBF. So join us. I also would like to thank AbbVie and Pampers for supporting the Preemie Power Week. I also want to thank CPBF team who work really hard to make this week possible. CPBF is a registered charity, and your donations this week will go to our COVID care program to provide therapy sessions for NICU families. Please donate on our website, canadianpreemies.org. Together, we can create a brighter future for all NICU families.